My name is Dr. Mary Claire Haver. I'm a board-certified OB-GYN and the creator and founder of the Galveston Diet. And today I am here to talk to you about the perfect storm of menopause and what may have been working well for you in the past as far as how you feel, how you sleep, weight loss, all of it, and where you gain weight is dramatically changing in this perfect storm of midlife and menopause. So, in my research for the Galveston Diet, I kept running across a current theme that inflammation levels are dramatically increasing in midlife, especially when our hormones start changing for women in menopause. And there's three factors kind of playing together, and there's a traffic circle. They're kind of all feeding into each other and creating this vortex that's spinning faster and faster. So the first is aging. Okay, we can't get away from that. We are going to age. Every day we're aging, we're getting older. And in essence, our bodies are meant to break down slowly over time. We're not meant to live forever. And that process, however, you can speed it up or you can slow it down. And at the end of the day, it's just our body's ability to heal when it's faced with the inevitable insults from, sun and radiation and bad choices and disease. Our ability to fight off those things and to heal gets a lot tougher with the aging process. That process is also exquisitely sensitive to nutritional choices and changes that we make. I did not realize how closely linked the aging-associated inflammation was linked to dietary choices. Absolutely blew my mind. The second thing that's happens to us specifically as women are very dramatic hormone changes, as we all know, that we go through in midlife associated with the decreasing and then deceased function of our ovaries. So ovaries lay dormant as we go through childhood, and then in adolescence they start waking up. They start, it depends on the person. They're a little girl, 9, 10, 11, 12, 13. They wake up, they start creating hormones. It gets into the cyclical cycle. Our periods start, breast, all of it. And that cycle goes on and on and on until late 30s, 40s for some women, and the menopause is simply your period stops for 12 months. No period for 12 months, you're in menopause, is the classic definition. Now, menopause means lots and lots of things to different people. But here's the interesting thing, also something I was never taught and I didn't realize, that when they measured inflammatory markers in women, so things like IL-6 and there's lots of chemical biomarkers of inflammation, and they just measured them once a year, every few months over time throughout the menopause transition. Those markers went up. They didn't have cancer, they weren't sick, they weren't fighting things. Just the fact that our hormones are changing sets off a level of inflammation in our body. Okay, so the aging process and hormone changes increase inflammation, especially joint pain. And guess what? Hormone replacement therapy, it doesn't get better. So those changes are more linked to a very basic biochemical level, and replacing the hormones will not fix that. Now, replacing hormones will help with a couple of other things. That's a discussion with you and your doctor. But if you're thinking that replacing hormones is going to affect your inflammatory levels due to menopause, actually, there's no studies that's showing that it does. That just blew my mind. Okay, so we've got aging, hormone changes. Those two things together lead to deposition of fat across our midsection, unrelated to changes in diet. When we start getting visceral fat, when we start getting gut fat, when we start looking bloated and feeling, where's the spare tire? I cannot tell you how many patients came to me and were like, Dr. Haver, I'm not doing anything different. I'm on the same nutritional plan. I've been working out the same. And all of a sudden I get to X age, or this happens with my periods or whatever. I'm starting to have hot flashes, and I've got 15 to 20 pounds and it's all in my middle. Well, let me tell you, that centripetal fat, that middle fat, that gut, that spare tire, whatever you want to call it, acts like an organ on its own. That abdominal fat also pumps out inflammatory cytokines at unbelievable levels. So now we have all these three things working together to just increase our chronic inflammatory levels. It's really, really mind-blowing, okay? Men have some of it. They definitely age. They have some hormone changes, but nothing like what we go through. And if you look across all cultures where women gain weight once they go through midlife, it tends to be all in their middle, okay? And that middle fat becomes an inflammatory organ on its own. So here's the cool thing. So that was the bad news. Here's the good news. These changes, like I said before, like I said just now, are exquisitely sensitive to changes in nutrition. As a matter of fact, when I started doing the research for Galveston Diet, you know, I was focused on how do I help myself? I was very selfish about this. How do I help me? What is going on? This fat in the middle won't go away. I'm doing all the same things. I'm doing all the tricks. I'm working out more. I'm eating less. I'm working out more and I'm eating less. I'm becoming obsessed. I'm getting on the scale every day. It's not working. And when I really did a deep dive into this and learned about this triad and how it all affects each other, and I was like, okay, fine, I believe it, fine, inflammation, that's the answer. What do we do? Every single bit of the research points to nutrition, not a pill, not a drug, okay? Not surgery, simple, basic nutritional changes are the only way to fight chronic inflammation due to these. Here's my notes. Here's my little traffic circles. I really do read research all the time and take notes. The way to go is nutritional changes. So when I developed the Galveston Diet, when I really thought through all this, when I practiced it on myself and it worked like crazy, when I showed it to my girlfriends and they couldn't believe it, when I started giving it away on Facebook, there's no magic. It's just smart nutritional changes. I don't recommend pills. I'm not a regular supplement recommender. There are a few that I feel like if you're lacking in your diet, you do need to supplement fiber, omega-3. It's no secret. But what I learned on how to treat this, every single recommendation was nutrition-based. Every single one. So the reason why all those tricks weren't working, because you probably got away with it when you were younger. Your diet wasn't the greatest, okay? You were probably eating too many things that cause inflammation, okay? Which was feeding this traffic circle like crazy. When you go through the Galveston Diet Signature Program and you learn the science, I go through everything step by step by step. It will blow your mind. You will see how these simple nutritional changes, like cutting out the things that cause inflammation and adding in lots and lots and lots of the things that fight inflammation, learning about intermittent fasting, learning about where to focus your fuel for longevity. It will absolutely blow your mind. The Galveston Diet is more than weight loss, okay? It is a lifestyle change for you to age well, for you to stay as healthy as you can through the aging process. I cannot stop you from aging, but what I can do is give you tools for you to get through this process as healthy as possible. So weight loss is a side effect. What's happening? You're sleeping better. You're decreasing your risk of neurodegenerative disease like Alzheimer's and dementia. You're decreasing your risk of cancer. I'm not saying you're never going to get it, but you might have tools in place to delay the onset or even fight it off or make you a lot healthier if you do get the diagnosis. Decrease heart disease, cardiovascular disease, stroke, all of it. Simple nutritional changes, okay? I don't give out pills. I don't recommend surgery. I simply walk you through a science-based, evidence-based nutritional program for you to have the best health in your life. The Galveston Diet is an anti-inflammatory diet designed for women in midlife to get you through this process as healthy as possible and give you a framework to age well. Why did I do this? I had unexplained weight gain when I started going through menopause. My brother had died. I've lost 2 brothers and I've got a 3rd with stage 4 esophageal cancer. I am 51 years old. I do not have a sibling that has made it past 59. So it's very personal to me. And I thought, it works. I can't promise I'm not going to get cancer or the other diseases that affect my family, but I am going to be damn sure that I'm going to do everything in my armamentarium. I'm going to read, I'm going to research, and I'm going to learn. And it just blew my mind. You know why calorie counting doesn't work at our age? Because when you simply pay attention to the quantity of food you're eating and not the quality of food, not filling in all the awesome anti-inflammatory foods, it doesn't work because you're feeding the inflammation machine. That's it. It's so simple. When you're eating those little bars, eating out of boxes, not paying attention to how much omega-6 fatty acids you're getting, which are hugely inflammatory, when you're not paying attention to the quality, to the, phytoestrogen, not phytoestrogen, to the, all the things are running in my head so fast, to the fiber, to the vegetables, to the fruits, to making sure you're eating the rainbow. It is so simple, so easy. And is it going to mean you have to make some changes? Yes. You're going to have to start paying very close attention to what you eat. You are going to have to put some time and energy into thinking about it, preparing for it. We give you so many tools and framework. The Galveston Diet Signature Program is $49, one-time fee. The charge will go up in the new year. We've had it out for a little over a year, but in 2020, the price is going up to $59. So Dr. Haver is going to go back to work and get off her soapbox right now, but it's worth the investment in yourself. If you were feeling like me, frustrated because you weren't understanding what was happening to your body and why, you were doing all the same things you'd always done and it just wasn't working anymore, and you were looking at your midsection going, what the heck is this? I've got a plan for you. And it's based on all of my research. It's all medically based. I have all of the evidence there. I have links to journal. If you're real sciencey, I have links to all the medical articles. I also have links to layman's articles. I take a lot of time step-by-step explaining everything to you, and I'm so excited for you to join me in this program. So keep following me. Share this, everyone. Share the health, and we'll chat later.